I was alarmed by your written testimony. I didn't get to hear all of the oral, that the discharge rates to long-term hospitals are about 40% lower for those enrollees that have Medicare Advantage versus those in traditional Medicare. I think Medicare Advantage is a real problem for taxpayers since they get overpaid. It's a problem in terms of quality of care in this situation and others. Perhaps they've been able to maintain this position where they don't save taxpayers any money. They cost us billions of dollars in providing lesser care by the fact that they invested in this Congress $330 million in lobbying expenses between 2020 and 2024.
The delays once an assessment is done on a patient who has Medicare Advantage and working through the appeal process is time-consuming and resource intense. It delays that patient's access, and at times the patient then and the hospital that's referring them may not want to work through that process with us. And so as a result, we'll discharge the patient to a less intense setting where they don't receive the care that they need.
So it literally could lead to patients being required to leave your facility and not receiving the care that is needed.
Correct.
Look, I think Medicare Advantage is making a steal on everything here. Medicare Advantage will start with a great intention, but is absolutely determined that they're going to steal the taxpayer dollar hand over fist. Average wait time for the patients was 73 days. 73 days for these 360 people. 51% of the patients waited over a month, 25% waited 3 months to 2 years. Fee-for-service Medicare needs to be fixed, but good Lord, our Medicare Advantage plan needs the wrath of God to come down and fix that system.
And we contract with Medicare Advantage plans today. It adds hours, days to the pre-authorization process and delays access and delays care. Patients literally die during the discharge planning process waiting for the authorization, Congressman.
We are deeply concerned that CMS's proposed neutral contractor sides with MA plans nearly 100% of the time during the appeals process. We have two patients that look exactly alike. One has Medicare Advantage, one has traditional fee-for-service Medicare. The fee-for-service Medicare patient we can bring right in, no delay. The Medicare Advantage patient, we need to get prior authorization. They're usually denied. They go through an appeal process. Think about that family. And we have often had this input coming from family members. They visit with each other. They're in the rooms right across from each other, and one will say, how come that patient can go to Madonna, but my family member can't? Well, it's because you have a Medicare Advantage plan and they're delaying your admission and they're denying it.
I also consistently hear that patients experience long delays in post-acute care due to Medicare Advantage's plan's prior authorization practices.
The delays result from the process that has been set up by the Medicare Advantage plan. Fee-for-service Medicare patients, we can assess that patient and bring them in within 1 day. If it's a patient who has Medicare Advantage, we have to take that clinical information. We have to provide it to the Medicare Advantage plan for approval to bring the patient in. Often what we see is an immediate denial.
And how often are those prior authorization claims denials appealed and overturned?
Roughly maybe 40% of the ones that are initially denied can be overturned during appeal.